A world-renowned fertility doctor is getting ready to perform the first ever live ovarian tissue transplant in the U.S. Dr. Sherman Silber will perform that procedure tomorrow at St. Luke's. Now, the case involves 24-year-old identical twin sisters from Alabama. Melanie was born with normal ovaries that have produced 3 successful pregnancies. Her twin Stephanie was born with non-functioning ovaries. Stephanie already had 2 unsuccessful in vitro fertilization procedures using Melanie's eggs. So now, during a 2-hour procedure, doctors will implant one of Melanie's ovaries into Stephanie. That, of course, is in hope the tissue will reproduce so Stephanie can eventually have a normal pregnancy.
We know how big it is, but of course we don't know as far as how far science will take it.
I was just really tickled that I could do this for her and then not tell how many women down the line, if this works. And so I'm just excited.
After this procedure, Stephanie says she and her husband will start trying to get pregnant as soon as possible. We'll keep you posted.
A historic operation in Chesterfield tomorrow could provide a breakthrough treatment for infertility. Tonight we talk with 2 women, twins, who hope the procedure lets them have something else in common, motherhood. News Channel 5's Cordell Whitlock has our other top story.
Ovary transplants normally involve frozen tissue, but tomorrow afternoon, doctors at St. Luke's Hospital will try something new. And if all goes well, twin sisters from Alabama will have the thrill of a lifetime.
No, we tried in vitro once.
24-year-old Stephanie Yarber started going through menopause at age 13. By 14, she had no ovarian function. Stephanie tried getting pregnant through in vitro fertilization.
I mean, when you have infertility, it's heartbreaking. And when it didn't work, and I'd gotten upset, and, I cried, and Melanie come over there, and I think she cried harder than I did.
I said, "You'll be fine." I said, "But you can call me."
Melanie Morgan is Stephanie's identical twin, a woman with 3 healthy daughters.
So we're going to transplant an ovary from the normal sister.
Dr. Sherman Silber, a renowned fertility expert at St. Luke's Hospital, will transplant one of Melanie's ovaries to Stephanie, the first type of procedure involving live tissue. Dr. Silber is confident the procedure will work.
It'll mean that this recipient will not have to be on hormone replacement. She'll start menstruating normally. She'll have normal hormones, and she should get pregnant on her own without ever having to go through IVF.
A possibility Stephanie has only dreamed of, and the fact her children would literally be part of her twin makes it more special.
I look at her girls, and they'll look like me, her and her husband. And, I just can't explain how that's going to feel, if it works. There's just no words to explain it.
Past, present, and future is always, we're always going to be there for each other.
Because the twins are a genetic match except for their ovaries, Dr. Silber says a successful procedure could be beneficial for the millions of women dealing with infertility.
To see if we can figure out why there are women with less severe cases that become infertile in their 20s instead of in their 40s the way they're supposed to.
Stephanie did extensive research on ovarian transplants and approached Dr. Silber about tomorrow's procedure. If all goes well, Stephanie will start menstruating in 3 months with normal hormonal function. We'll keep you posted. Mike?
All right. A medical breakthrough in infertility treatment happened this afternoon in Chesterfield. Doctors transplanted 2 sets of ovarian tissue from 24-year-old Melanie Morgan into her twin sister, Stephanie Yarber. The procedure took 5 hours. Both women are doing well tonight. Stephanie is expected to ovulate within 3 months and could get pregnant within a year.
We gave her a full transplant on both sides, so she now will have 2 good ovaries. But we also had ovarian tissue left over that we have frozen.
Blood and tissue samples taken from the twins have now been sent to molecular biologists at MIT. Using Melanie's genetic code as a guide, it's hoped scientists can map the exact gene that mutated in Stephanie, leading to her premature menopause.
I'm Lori Waters, live at St. Luke's Hospital, where the world's first live tissue ovarian transplant is underway. I'll have that story coming up.
Medical history is being made today in St. Louis. It has to do with identical twins and one of the woman's chances of having a baby. Lori Waters is live at St. Luke's Hospital with the latest. Lori?
Well, Rochelle, it is the world's first live tissue ovarian transplant, and it is scheduled to be underway at this hour. It is being performed by fertility expert Dr. Sherman Silber. His patients are 24-year-old twin sisters from Alabama. Now, one of those sisters has 3 children after 3 normal pregnancies, but the other underwent menopause in her teens. 2 attempts at in vitro fertilization failed. The sisters basically got on the internet, tried to find out the latest in the field of fertility, and approached Dr. Silber about trying this procedure that has been attempted on animals but not humans. Dr. Silber describes the procedure.
We're going to take one ovary out of the normal twin, and we're going to transplant it into where the ovary should be, so we say the atrophied or the dead ovary, or maybe there won't even be an ovary in the ovarian fossa of the other twin.
Now, Dr. Silber notes that this is a very unusual case because the identical twin sisters are an identical match. So he is very hopeful that this will be successful. If it is successful, attempts at pregnancy could begin as early as 3 months. Now, this is an outpatient procedure, but the sisters will be staying here overnight for observation. They, of course, say that they are very hopeful, but last night when they talked to News 4, they said they are just looking toward the procedure, and then they'll deal with what comes next later. Rochelle?
All right, Lori, we certainly wish them the best. Thank you for that report.
Dave, we'll get back to you. A first-of-its-kind surgery in St. Louis, and tonight doctors are calling it a success. It could lead to new breakthroughs for helping women with fertility problems. Fox 2's Len Turner is live at St. Luke's Hospital in Chesterfield with the latest. Len?
I'll take that groundbreaking surgery lasted just a few hours here this afternoon, but tonight medical experts say its impact could be felt for years to come. In the operating room at St. Luke's Hospital, doctors doing something they've never been able to do before in the U.S., transplanting a living ovary from one woman to another. In this case, identical twin sisters. Melanie Morgan on the left has 3 children and healthy ovaries. Her sister, Stephanie Yarber, had no hope of ever having kids until now.
It's just been devastating watching, because she'll get my kids and watching her walk up the driveway with one of them, and it just looks, it's horrible. When she's giving birth to them and they're, you hear them crying for the first time, that just kills you.
The surgery lasted 5 hours Wednesday. Doctors transplanting live tissue from Melanie's ovaries. If it works, they say Stephanie might be able to become pregnant within a year. Fertility specialist Dr. Sherman Silber says it's a big step forward, not just for the twins, but all women.
That's the overriding issue for women today. Is the biggest issue they face in their 20s is, when do I have a child and when does my biologic clock run out? And that's genetically determined. Some women are fertile when they're 45, others lose their fertility when they're 25. And this case will give us a genetic handle for studying it, and we will figure it out. Based on these 2 women, we'll be able to figure that out.
This could change so much for science and for women or girls who went through this, like I've went through this, and, that they will have other options.
And both of those women still here in the hospital, both still recovering tonight, but we are told they are doing just fine. They are expected to speak about their experience in surgery publicly for the first time tomorrow morning.
Len, it is kind of amazing. Could this surgery be applied to any 2 women?
Well, the short answer to that is no, not yet. That is what scientists are hoping for at some point in the future. Right now, though, because this is so groundbreaking, only identical twins are qualified for this kind of surgery.
All right, Len, thank you.
Also in this half hour, groundbreaking surgery. Identical twins share a gift. One sister gives the other her ovary so that she can finally have children. This is truly amazing, and that'll be coming up in a minute, too.
All right, thanks, Troy. In today's Healthy Woman, we have what is a rare transplant surgery, and it may give a young woman the gift of motherhood. 24-year-old Stephanie Yarber started going through menopause at the age of 13. Nothing unusual there, but 1 year later, her ovaries simply shut down. They didn't work at all. And now her twin sister, Melanie Morgan, has donated one of her own ovaries. in what was a remarkable 5-hour transplant operation. Stephanie, Melanie, and their fertility surgeon, Dr. Sherman Silber, are joining us now from St. Luke's Hospital in St. Louis, Missouri. And I thank both of you for being with us. And I'm not sure which is Stephanie and which is Melanie, because you are, after all, identical twins. So you're going to have to help me. Stephanie, hold up your hand.
I'm Stephanie.
All right, and then but by process of elimination, Melanie, that's you in the middle.
That's me.
Dr. Silber, this is the first time this operation...
And I'm Dr. Silber.
That one I know.
I'm not Stephanie or Melanie.
That one I had figured out. This is the first time this operation's been done in the United States, right?
Yeah, it absolutely is the first time, and the first time between identical twins where we really have a proper indication, one twin having completely no ovarian function, menopause at age 14, and the other twin, 24, having absolutely normal, wonderful ovaries, not even compromised ovaries, but ovaries that are extremely fertile.
Right,
so one being transplanted to the other.
And I'm going to come back to that as to why you had to do this with twins. This is the first time this operation was tried. But Stephanie, I presume that you had tried in vitro fertilization?
Yes, sir, we have.
And that didn't work?
We tried it. No, sir. Pressure frozen cycle, it didn't work.
And now with this surgery, the expectation is that pregnancy will be possible?
Yes, sir. A natural pregnancy.
That must be quite something to get your mind around, having thought that this was never going to happen.
Oh, it is. It's, it's exciting. We're all excited.
Melanie, when the possibility was raised and you would be the donor, even think twice about it?
No, I never hesitated at all about doing it. She's my sister, and I would do anything for her, and I never hesitated.
As I thought about it, this is rather strange. If this operation is successful, and if Stephanie gets pregnant, then there'll be actually your eggs, right? Since it's your...
Well...
Is that right? Yeah.
It would be, but I don't really look at it that way because DNA were the same, and if she had had her own eggs, then they would be just like mine anyway.
Mm.
So, they're hers. That's the way they're hers now. I don't even look at it like they're mine.
Dr. Silber, let me come back to you. Why did it have to be as a first-time twins?
Well, because the ovaries will reject. They're not what we call a privileged site. So if you were even to transplant from siblings that aren't identical, you would have rejection of those ovaries unless they were placed on immunosuppressive drugs, which carry risks that people don't want to really take. So this is a situation where there doesn't have to be any follow-up treatment, no in vitro fertilization, no donor eggs, none of the months and months and months of injections and planning that they had to go into. So this is a perfect situation because there won't be rejection.
But I'm curious about that the immunosuppressant drugs, because there are a lot of those drugs. That runs a danger to any fetus that might come about?
Well, actually, women that have had kidney transplants have gotten pregnant and had normal children. The immunosuppressive drugs, the real issue is that it's medically they're potentially dangerous, and you would do it for a kidney transplant.
But eventually, eventually, is it possible that this can be done in people who are not identical twins?
Oh, yes. I'm sure that in the next 5 or 10 years, if immunosuppressive drugs can be improved so they're made more benign, and progress has been made in that direction already dramatically, then you could do exactly this procedure between non-identical individuals.
And basically...
The first case had to be with identical.
And basically a complicated or a relatively straightforward surgery?
Well, actually, the original procedures we developed were extremely complicated, but we think we simplified this into something very relatively non-invasive, and could be a routine surgery that could be performed many places.
Well, I know it's about 3 months before you find out if this has been totally successful. And so, Stephanie, Melanie, I hope you'll let us know how it goes. And congratulations, Stephanie. We got our fingers crossed for you.
Thank you so much.
All right. All the best to you. Very interesting. Dr. Silber, thank you very much as well. When we come back.
All right, Harry, thanks. It's billed as a medical first. An infertile Alabama woman is now carrying a transplanted ovary that came from her twin sister. Stephanie Yarber received the ovary from her Morgan yesterday. They join us this morning along with their doctor, Sherman Silber. Good morning, everyone.
Good morning.
Oh, Stephanie, let me ask you how you're doing. The surgery was just yesterday. I know that you guys, it was done an outpatient procedure, but how are you?
I'm feeling pretty good.
Yeah?
Feeling better than I expected to be. Mm-hmm.
Well, good. Well, I would imagine you're kind of excited about the prospect of actually getting pregnant, because I know that you've been trying for some time, a couple of years at least, to get pregnant, and you tried twice through in vitro fertilization. How did you finally come to meet Dr. Silber?
I had been researching, just doing some research, and found Dr. Silber and his credentials, and he was wonderful. And I spoke with my former RE, and he recommended him very highly. He said I couldn't have found the best. He was wonderful.
Melanie, you have 3 children of your own. Why was it so important to you to want to be a part of this, to donate this ovary to your sister?
Well, like I said, we've done the IVF before, and it failed, and I knew she wanted to have kids, and I know the joy of having them. So I was more than happy to do this for her and for every other woman, especially if this works.
Yeah, this is potentially groundbreaking. Dr. Silber, let's bring you in on this. We should note that the reason Stephanie had this surgery is because she went through menopause at age 13, and therefore was unable to conceive. What should you see in the coming months from Stephanie? Will this ovary all of a sudden just turn on and start releasing eggs? What will happen?
Yes, we would anticipate that Stephanie, who went through menopause at age 13, actually, and really has no eggs in her original ovaries, they should start to cycle, and she should start to have menstruation sometime in the next 3 months. And at that point, she can get pregnant anytime after that. And it will be a spontaneous pregnancy, not requiring any medical treatment, Clomid, gonadotropin, or in vitro fertilization. Just a natural pregnancy.
That is amazing.
The old-fashioned way. The old-fashioned way.
The old-fashioned way. So the chances are pretty good that she will conceive and have a viable pregnancy.
We think the chances are very good. Of course, we told her you can't guarantee anything with a brand new procedure, but there's been 15 years of research behind this, and the operation went beautifully. So we're very comfortable that this should work.
Stephanie, let me ask you this. What an incredible act of selflessness from your twin sister. Tell me about your relationship. You two must be very close.
We are very close. And it takes a special person. And Melanie's, that's just who she is. She didn't even hesitate when I asked her about it.
Well, that is great. That is great. Good luck to you. And come back when you're 9 months pregnant. Come back and be on our show, okay?
Okay.
Stephanie Yarber, Melanie Morgan, and Dr. Sherman Silber. Thanks so much. Good luck to you all.
Thank you.
Still ahead, the fight to
infertile at an early age, received an ovary from her sister. Dr. Sherman Silber is the director of the Infertility Center of St. Louis at St. Luke's Hospital. He performed the surgery. Melanie Morgan donated the ovary to her sister, Stephanie Yarber. Good morning to all of you.
Good morning.
Stephanie, how are you feeling, first of all?
I'm feeling pretty good. Feeling better than I thought. For having surgery yesterday, I feel pretty good.
Let's talk about the condition you had. I mean, you're identical twins. At 11 years old, you both entered puberty, but a couple of years later, you were infertile. What exactly happened?
I went through early menopause.
And so by 13, you were in menopause and no longer fertile, correct?
Yes, sir.
And Melanie, I know there was some concern because you're identical twins that you would have some similar issues. That wasn't the case at all?
No, they have an 80% chance, but that never happened. I had 3 little girls, so it never happened.
And now, I know, Stephanie, you've been trying to have children for some time, and you've gone through in vitro fertilization on a couple of occasions. Were the eggs donated by Melanie?
They were. I went through a fresh cycle and a frozen cycle.
And which, by the way,
it didn't work.
I should mention, it's a very expensive procedure as well and also emotionally taxing. So how did you find out about Dr. Silber?
Actually on the internet.
And
I started researching.
And what did you heard about him?
Oh, I heard that he was a wonderful doctor, and I spoke with my former RE who knew about Dr. Silber, and he said that he would be great.
Dr. Silber, let me turn to you. I understand there have been tests and surgeries and things like that with animals in the past. What made these two women a good candidate for the procedure that I'm going to ask you to describe in a second?
Well, firstly, they were identical twins, genetically identical twins, so that we didn't have to worry about rejection or immunosuppressive drugs. Secondly, is that the twin who was fertile, Melanie, really had great ovaries. She was very, very fertile. The fear that she might have early menopause herself in her 20s and have a very low egg supply really didn't pan out. She had great ovaries. So for those two reasons, they were just perfect candidates for this procedure. Plus, they'd already been through IVF at an extremely good program, which failed times two, and so they were kind of fed up with that and wanted to try having a natural pregnancy.
So, doctor, you removed one of Melanie's ovaries, and then I understand you actually dissected it. Is that right?
Right. Actually, the ovary was removed by one of my really great colleagues, David Levin. He's a master at this. And then he handed the ovary to me, and then I dissected it microsurgically on the bench in cold media so that it would be prepared for being able to be transplanted to Stephanie, and then I performed the transplant.
And so you actually transplanted it, a little of it, into each of Stephanie's ovaries. Is that right?
That's exactly what we did. We were able to divide it up and transplant some. It was such a huge ovary. It was so wonderful. There were so many eggs that we transplanted enough tissue to each of the two ovaries, and we even had some left over that we were able to freeze as backup for any kind of future mishap.
Okay, so now Stephanie has parts of Melanie's ovaries transplanted into her own ovaries. I guess the question is then, if she becomes pregnant, these would be Melanie's eggs, correct?
Well, they would be eggs that derive from Melanie's ovaries. They're genetically identical to Melanie's, but they're also genetically identical to what Stephanie would have if she were born with normal ovaries. So it's the issue of bonding and whose baby it is, you could ask them about. I don't think it's an issue.
Stephanie, is that any issue? I guess it shouldn't be an issue because you've already tried IVF with Melanie's eggs anyway, correct?
Correct. Yeah. No, we don't. It's not an issue to us. Her kids, look like me, her and her husband. So, we're excited about this, and so it's not an issue for us.
The surgery was performed yesterday. How long, doctor or Stephanie, how long might it take to know if this is going to work?
Well, we think that Stephanie should start to menstruate, which she hasn't really done in 10 years, in about 3 months, and she can get pregnant anytime thereafter. And it's kind of remarkable. They're only 1 day post-operatively, and they have some pain, but they're doing very well already.
Stephanie, with all you've been through and all the attempts you've made to conceive, it must be wonderful to have a sister who is so supportive.
Oh, it's great. It's unexplainable.
And Melanie, after all that your sister's been through, how will you feel if she is finally able to conceive?
Oh, I'll be extremely excited when she's able, if everything works out the way that we hope it is, when she conceives. I'll get to spoil her little girls or little boys. Hopefully little boys, we've got little girls, and send them home.
Briefly, Dr. Silber, these are identical twins. That's why it works so well. But what are the ramifications for this? Is this going to be something we're going to be hearing much more about in 10 seconds?
There are 3 ramifications, really. One is we're going to learn genetically what causes women to be infertile by studying them. We're going to have a better opportunity for transplanting ovary back to cancer victims.
Right.
And we're going to even be able to preserve the ovary for women that may not want to have children until their 40s and preserve their fertility until otherwise they would have been infertile.
Well, congratulations to all of you, and thank you.